Before we do anything else today, let's do a very simple men's health self-check. In the next 30 seconds, you're going to get a quick snapshot of whether blood in your urine may need attention soon, or whether it may be showing signs doctors treat as a true emergency. No panic, no complicated language, no guessing, just honest answers. If you are over 60, this conversation matters more than many men realize, because blood in the urine is one of those symptoms that can be serious in more than one way. Sometimes the danger is what may be causing it. Other times, the danger is what the bleeding is doing right now. Is it causing blockage? Is it coming with severe pain? Is it showing up with fever or back pain? Those are the questions doctors start asking very quickly. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 warning patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether your body may be showing a serious warning sign or a pattern that can turn into a true emergency if ignored. And stay with me until the end, because the #1 mistake men make with blood in the urine is assuming that if the cause might be something common, the situation itself cannot still be urgent. Let's begin. You start with 7 points. Number 1. Have you seen visible blood in your urine, especially more than once or in a large amount? If yes, subtract 1 point. Number 2. Are you passing clots, or does the urine look thick, dark, or heavily bloody instead of lightly tinged? If yes, subtract 1 point. Number 3. Are you having trouble urinating, unable to empty your bladder, or feeling like urine is blocked? If yes, subtract 1 point. Number 4. Do you have severe pain in the lower back, side, pelvis, or abdomen along with the blood? If yes, subtract 1 point. Number 5. Do you also have fever, chills, nausea, vomiting, or feel systemically unwell? If yes, subtract 1 point. Number 6. Are you having weakness, swelling, loss of appetite, weight loss, or other symptoms that make this feel bigger than one bathroom symptom? If yes, subtract 1 point. Number 7. Have you been telling yourself that because blood in the urine can have many causes, it probably is not urgent? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing many obvious emergency patterns right now, and that is good news. If you scored 4 to 5, your body may be sending mixed signals. That does not automatically mean a medical emergency, but it does mean the pattern deserves prompt attention. If you scored 3 or lower, please do not panic, but please do not minimize this either. When blood in the urine comes with blockage, severe pain, clots, fever, or deeper body symptoms, doctors think differently and move faster. The goal today is not fear, it is clarity. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and what worries you most right now. Is it clots, pain, trouble urinating, fever, back pain, or fear that it could be cancer? Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. Blood in the urine, also called hematuria, should never be ignored. Cleveland Clinic says blood in your urine can be an important warning sign that something is wrong with your body and says to contact a healthcare provider as soon as you find blood in your urine. It also notes that associated symptoms can include frequent urination, pain or burning, urgency, nausea, vomiting, fever. Mayo Clinic says visible blood in the urine, called gross hematuria, is important to evaluate because blood seen with the naked eye can be a sign of serious disease, including kidney, bladder, or prostate cancer. It also notes that passing blood clots can be painful. The American Cancer Society says blood in the urine is often the first sign of bladder cancer, and early bladder cancer often causes bleeding with little or no pain or other symptoms. But it also says that more advanced bladder cancer can bring inability to urinate, lower back pain on one side, weight loss, tiredness, swelling in the feet, and bone pain. So the lesson is this: blood in the urine is always something to take seriously, but certain added features are what make doctors worry less about simple evaluation and more about urgency. So now let's count down the 3 biggest messages your body may be sending when blood in the urine becomes a true emergency. We're going from number 3 to number 1, and number 1 is the one older men misunderstand the longest. Number 3 is this: your body may be telling you that blood becomes more urgent when it stops being just blood and starts affecting your ability to function. This is where a lot of men get the first emergency clue. The problem is no longer just what they see in the toilet. The problem is what the bleeding is doing. Maybe clots are forming. Maybe urination becomes slow, strained, or blocked. Maybe the bladder feels full but nothing comes out. Maybe the pain starts rising with the bleeding. That is a very different situation from simply noticing a trace of blood and still being able to urinate normally. The American Cancer Society lists being unable to urinate as one of the symptoms that can occur in more advanced bladder cancer. And search results from Mayo Clinic and Merck Manual both emphasize that clots can become a real problem because they can hurt and, in severe cases, block the flow of urine. Here is how to think about this more clearly. If blood is present but urine still passes normally, that is one kind of concern. If blood is present and now you cannot pass urine well, feel blocked, or are straining against clots, that becomes a much more urgent mechanical problem. What should you notice? Not just the color of the urine, but whether the urinary system still works. Why does this matter? Because an older man may focus entirely on the cause and miss the fact that the immediate emergency is obstruction. The most common mistake is thinking, it's just blood, when the real emergency is that the bladder may no longer be emptying properly. If you need an easier version of this check, ask yourself one question this week. Is the bleeding just visible, or is it interfering with urination itself? That question can reveal a lot. Number 2 is this. Your body may be telling you that blood with severe pain, fever, or feeling sick changes the urgency fast. This is where doctors start looking for more than irritation. They start thinking about stones, infection, kidney involvement, significant inflammation, or a more advanced urinary tract problem. Cleveland Clinic says associated symptoms can include fever, chills, nausea, vomiting, lower back pain, abdominal pain, and flank pain. Those are not small details. They change the picture. The American Cancer Society says bladder cancer symptoms can include lower back pain on one side, and Mayo Clinic lists back pain among possible bladder cancer symptoms as well. Now let me be balanced here. Pain or fever does not automatically mean cancer. Very often it does not. But blood plus severe pain or systemic illness is exactly the kind of combination doctors do not want older men sitting on at home. Here is how to think about it more clearly. Blood alone is a warning. Blood plus severe one-sided back pain may point toward a stone or something obstructive. Blood plus fever and chills may suggest infection. Blood plus vomiting or feeling truly ill may mean the whole urinary system is under more stress than it first appeared. What should you notice? Whether the symptom is still local or whether the whole body is now reacting. Why does this matter? Because once blood in the urine starts traveling with fever, severe pain, chills, or vomiting, the conversation shifts away from "watch this closely" and toward "this may need urgent evaluation." The most common mistake is assuming urgency depends only on how much blood you see. If you need an easier version, ask yourself this. Do I just have blood, or do I also feel truly sick or in real pain? That distinction matters. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be seeing frightening urinary symptoms and trying to make sense of them quietly. And if you've made it this far, let me know in the comments which symptom makes men hesitate too long before getting help. Now let's get to number 1. Number 1 is this. Your body may be telling you that the true emergency is not always the amount of blood. It is the pattern doctors see around it. This is the message older men miss the most. A lot of men think emergency means dramatic bleeding, pure red urine, large clots, a toilet bowl full of blood. And yes, that can absolutely be alarming. But doctors do not judge urgency by color alone. They look at the pattern. Are you passing clots? Can you urinate? Are you having severe flank or back pain? Are you feverish? Are you weak or swelling? The American Cancer Society says advanced bladder cancer can bring inability to urinate, lower back pain on one side, swelling in the feet, weight loss, fatigue, and bone pain. Cleveland Clinic says untreated hematuria can lead to bigger problems, especially if the cause is serious, and early detection improves the chance of successful treatment. Here is what I want you to watch for. Are you thinking only about the blood, or are you noticing what the rest of the body is doing? Are you swollen or unusually weak? Are you dismissing the situation because you can imagine a benign cause, even though the body is showing clear distress? What should you notice if you stop minimizing the pattern? The urgency becomes easier to see. And once you see that, you stop asking only, could this be from something simple? And start asking the better question, is my body showing signs that this needs immediate care? Why does this help? Because it replaces false calm with better judgment. The most common mistake is thinking emergency is defined only by panic, when doctors often define emergency by blockage, infection, severe pain, or signs that something bigger may be going on. If you need an easier version, remember this. Blood in urine becomes a true emergency when it is paired with clots, trouble urinating, severe pain, fever, or body-wide warning signs. Now let me give you 3 daily boosters that can help older men think more clearly about blood in the urine and urgency. First, separate important from emergency. Blood in the urine is always important, but it becomes an emergency when the body shows distress around it. Second, track the whole pattern. Clots, blockage, severe pain, fever, chills, back pain, side pain, weakness, swelling, and urinary difficulty matter more than color alone. Third, do not let the possibility of a common cause lull you into delay. Infection and stones may be common, but common causes can still become urgent causes. Now let's close the loop. Think back to your starting score. If you scored low today, do not let that uncertainty disappear into the background. Recheck yourself in 2 weeks if the issue has already been evaluated and the symptoms are stable. But if you are having blood with clots, trouble urinating, severe pain, fever, or feeling acutely unwell, do not sit on it. That is the whole point of today's video. Today, we talked about when blood in your urine becomes a true emergency and what doctors look for. We looked at why blood becomes more urgent when it interferes with urination. This is not about panic. It is about recognizing when the body has moved from sending a warning to showing real distress. Your urinary health matters. Your bladder health matters. And when blood shows up with blockage, severe pain, or systemic symptoms, the right response is not delay. It is action. If this video helped you, share it with another man over 60 who needs to hear it. And if you want to keep going, watch the next video on your screen, where I'll break down why painless blood in the urine is one of the symptoms doctors take far more seriously than patients do. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.